Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630 WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied. Guess what? Come up with the same old, nothing? Well, this is your opportunity. Let's put the light on the subject, so to speak, and let's see if we can fix it. And speaking of lights, that's the topic of the program today. We're going to be doing low-energy light laser. We're going to get into quantums, quantum physics, a little bit in quantum medicine, and what that's all about. And it's kind of this huge subject that a lot of you don't know anything about, but we use in our office, and it's cutting-edge medicine today. It's stepping up the stake, if you will, at a level that most people would look at and say, oh my gosh, really? This stuff really works like this? Well, let's put it this way. Every professional team in the NFL, in the NBA, and it goes on, has a low-energy light laser unit, and we're going to talk about that. And that, by the way, is the subject of our in-house continuing education program this Wednesday evening, the 25th, at the Roselle Center for Healing in Fairfax. We're going to be talking about how it works and the applications, but more importantly, the applications as they relate to things like slow healing and chronic pain that just doesn't go away, and joint spaces that won't open up. You know, you kind of can't reach anymore, frozen shoulders. Inflammation, and we've talked so much about that. This thing works, and it makes a huge difference. It helped me in restoring a lot of my function when I got hurt over the last several years, and brought me back, as well as the good hands of my docs. But in studio to help me talk about it is our Dr. Gadget guy. Hi, Scott. Hi, Dr. Scott. How you doing?
Good morning. There you go again.
Well, you know what? When it comes to toys and things, you know, there's nobody that I love more dearly than you, and because you're always educating me, you're always putting me in a place where I have to learn something different. And low-energy light laser is one of those things that you love. And, you know, as a result, we have a whole bunch of them in the office, and we play with them, and you're always coming up with new angles. But, you know, it's one of those topics that people really don't get, they don't understand. And a lot of physicians out there have no clue. Matter of fact, the majority of physicians out there have no clue. But we're talking about energy medicine at a very, very high scientific level. So for our listeners, let's start with, what is this thing? What is, you know, this laser, this low energy light frequency? What is it?
Well, let's give an example of what laser is and what it stands for. It's light amplification of a stimulated emission of radiation. What?
Excuse me? What?
That what?
Come on, back
so it's
down.
a lot of that stuff. So really kind of think about it. You actually can do your own experiment. When you go outside and you get sun exposure on your skin, what do you get? You get, well, people
sunburn.
Increase,
no.
Well, if it's controlled, everything's in balance, right?
Okay.
So what you're looking at is vitamin D, because what happens is you got receptor sites on your skin that absorb energy. So basically you absorb energy. Energy is never created or destroyed. It's converted. So what happens, it gives the potential energy to a cell. A cell now directs that and makes vitamin D. So we actually get a photon source that's doing that. But there's other ways to stimulate to those receptors, and we've been finding it out since probably the 1920s. There's been some Russian scientists and some German scientists and so on and so forth, without trying to get too in depth, but they've been finding out that there's been emissions from different parts of, like, even plant life that can actually stimulate. The plant root can stimulate a plant root next to it by doing an emission of this radiation that absorbs and helps it to grow.
Well, the truth of it is that the majority of research that came out in low-energy light laser in this quantum area of medicine came out from the Russian and German scientists. And one of the reasons that we haven't known about it, or actually we have known about it but haven't used it, is because we are so drug-oriented in this country, and these laser applications can do everything and then more.
Well, I think to answer the question why we haven't done a lot or seen a lot of this is exactly that. The Russian and German, we've had the Cold War, very scientific journals that people don't kind of quite understand, or understand and being converted from language barriers to come across that information. I think also, again, the pharmaceutical aspects, we don't want to put our money into that. We want to put our money into pharmaceutical elements. So there's a lot of things that have not been seen or looked at or just kind of poo-pooed, but now they're coming
because
more
somebody's got an
light.
agenda. Yeah. So let's talk about what it is, and I'll keep my thought process in my back pocket because I irritate people enough when I get into that subject. So let's talk about something that actually can do everybody a little bit of good. A low-energy light laser is...
Okay. Do you want to make it really simple in two words?
You got to make it very simple. Remember, you're not talking to me. You're talking to people that I've got to keep you on track. So your brain is like far beyond most of us. So let's do what we need to do here.
Well, just to think of it, it's an energy. It's like a form of energy that the body can absorb, and it affects more than anything we're going to be talking about is. Where it gets absorbed mostly is in the mitochondria of the body. And if you think about mitochondria, if you think about the cell...
Now, mitochondria are little energy packs that run the cells.
I was getting there.
Okay.
So you got the cell battery, its furnace is the mitochondria. And actually what happens when this absorbs, it actually increases the rate of the mitochondria. And since it increases the rate there, it actually increases the ATP, which is our energy molecule to make us go. Okay, so ATP is adenosine triphosphate, which is the thing within the mitochondria that allows us to have the wherewithal, muscles to contract and, have tone and to have energy, and so we don't get fatigued out and all those things. 90% of our energy comes exactly from the mitochondria of the stimulation. Cool. So we got that piece. Now let's talk about how low-energy light laser, and we're going to talk about fatigue, and we're talking about chronic pain, we're going to talk about slow healing and inflammatory processes and so forth, and how this actually stimulates the cell, because we do it every day in our practice, and it's one of those things like, instead of having to send people out and sit in the sun all day long, we're using these things. And I know this Wednesday evening, and I'm playing with you a little bit now, but we're going to get into this in detail. I know you're very, very able to, you're going to put this step by step in the application. So listen, if you're having problems in slow healing, if you have frozen shoulders, if you have pain that just doesn't go away, if you have an inflammatory reaction, if you have blood pressure problems, if you have cognitive dysfunction, this application is really amazing. It's Star Wars. And we'd like to invite you. We'd like you to be our guest this Wednesday evening, the 25th of the month, at the Roselle Center for Healing. All you need to do is pick up the phone and call 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Scott Lamp's presentation this Wednesday on low-energy light laser. And it'll give you the application. Scott, you're going to do some demos as well this week? Correct. So you're going to show people how it works. Yep. And it's going to be a show and tell. It's just not going to be a didactic presentation. He's going to actually do this stuff on several of you and show you what can take place and what happens and how it strengthens muscles and so forth. So it's going to be a really, really interesting night. So I encourage you, please be there. Let's talk about the application. How it actually, what happens? These are wavelengths. These are, you set different frequencies in this laser, and they're on two carrier beams. Right. And these carrier beams are what? Well, again, I don't want to get too technical here. Without also, it sometimes helps with a little illustration to be seen. But when you're shining the light that goes through this wavelength that comes out, and what you want to do is find a certain wavelength that those cells like the most. And also you want to make them coherent, which means they're going to be focused just to that type of wavelength, that size, and that certain pattern or frequency to make the best stimulation for that particular receptor, that thing that's absorbing it. And we find sometimes that if we pulsate or change that frequency, each cell type has a different want. It's kind of like you think about listening on the radio. You might want to go to one station to listen to talk radio. You might want to go to another station to actually listen to a sports program or music. AM or FM is on a certain frequency, but if you regulate that frequency or wavelength, but if you change the frequency, you get a different channel. So each one of these cells can actually be programmed a little bit differently to actually receive a little bit more. So in other words, when you're hurt, when your body breaks down, when you stress out, all these things have an external influence on our body. We talk about structural, chemical, emotional stresses, right? So the stresses affect us genetically at a very deep cellular level. Correct. And a lot of time the programming gets all messed up, and that's one of the reasons that no matter what we do, we can't heal. Yeah. And when you use the... Well, actually, the example would be, maybe it might be a little easier. If I'm in an orchestra and the orchestra, let's say part of my orchestra is not working correctly, let's say one of the string instruments is not quite off, sometimes you can catch back. What you're trying to do is bring the whole symphony to work together, and that's what we're trying to do. This is what the kind of the rhythm or vibration that happens with this light therapy helps bring that out. Now, if the the orchestra is off considerably, like the whole string section goes off, then all of a sudden the whole tone of the music is bad. If one is bad, but all of a sudden starts listening to the other people, it actually starts getting back into the tone of what the music's being played. And so sometimes when we have chronic disease, we lose that rhythm, that music. Our orchestra gets fouled up.
So, to get it correct, what we're dealing with is amplified light waves,
right,
at different frequencies in carrier modulations.
Correct.
And what we're trying to do is we're trying to stimulate cell reproduction and repair.
Right.
And by using that, and what happens when we have things that are all messed up because of injury or stresses or bad dietary patterns or trauma or whatever, that cellular matrix to the genetic level gets deprogrammed.
Correct.
And then we'll use the light based on the carrier beams to be able to re-stimulate the repair process and accelerate and enhance the other therapeutic modes.
And it plays beautiful music.
Got it. Okay, so if I got it, maybe everybody else has it. We're here at 888-630-9625, 888-630-WMAL. My guest in studio, Dr. Scott Lamp. We're talking about low-energy light lasers. Dr. Scott will be your presenter this Wednesday evening at our in-house continuing education program at the Roselle Center for Healing. We'd love to have you as our guest. Give us a call, 703-698-7117, 703-698-7117. Tell my staff that you'd like to be there, and we encourage you that, listen, these programs are for you. They're absolutely no charge, but we do require a reservation because we have limited spacing, and once they're full, they're full. But we do these because we want to educate you. We want you to be able to learn more about how to take care of your life and how to maximize your body's potential and your body's ability. And by the way, I want to encourage you, and we're going to talk about it a little bit more later on, those of you who attend our in-house continuing education programs or our routine healthcare programs that we have every other week, you'll have an opportunity to actually save some money on this fall's Ageless Health program, but you got to come to find out what that is because I'm not going to tell you about it. You got to go. So anyway, Scott, let's go a little bit more. Let's talk about low-energy light laser and how we got about a minute and a half, and we're going to get back into it later on. Let's talk about how it affects inflammatory pathways.
Well, I think first off is free radical formation is one of the biggest things that help cause inflammation in the body. And what's interesting, there's a paradox in the mitochondria. When you activate them, they actually increase energy, but they also increase free radical formation. Laser in itself will actually increase the ATP or the energy, but does not increase free radical formation at the mitochondrial level. That's what's so unique with this type of therapy. You know,
there was an interesting article that was published in PubMed, and it's on low-energy light laser, and it's using a frequency of 632.8 nanometers. And what it said, it suppresses the formation amyloid B peptide induced oxidative and inflammatory response. And what that means is that it has an effect on Alzheimer's. Right. And other types of degenerative disease. I was really surprised. I was going through and you know, any time that I sit with you, I got to make sure that I'm up to date because otherwise I'm in trouble. And so I saw this article and I was really super impressed. And that, in fact, that we're getting not only random, you know, yes, it works, but reproducible over and over. But the oxidative stress and the inflammatory pathways in an Alzheimer's or cognitive patient is significant, and it really turns around. We're here at 888-630-9625. That's 888-630-WMAL. My guest in studio, your host this Wednesday evening, Dr. Scott Lamp. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about low-energy light laser. What's that all about? But you know what? If you're chronically fatigued and if you have limbs that don't work anymore and you're in a lot of pain and your body's just not healing the way it's supposed to heal and you've tried everything, well, this is another piece of the puzzle that takes us into space age. My guest in studio, Dr. Scott Lamp, who will be your host, your presenter at the Roselle Center for Healing for our in-house continuing education program this Wednesday, July the 25th at 7:30 p.m. give it a call, 703-698-7117. That's 703-698-7117, and tell my staff that you'd like to attend. Also, I'd like to encourage you to visit our website. Go to rosellecare.com. That's ROSELLECARE.com. Got a brand new website up for you. Looks good. A lot of action on it. Has a tremendous amount of information. Visit our iStore and get a copy of my book, by the way, Ageless Health. Health is a do-it-yourself program. And it's all there for your reading pleasure. And if you need to get a hold of us, you can do it that way as well, right through the website, and we will respond to you and get back to you. Dr. Scott, before we get further into the subject, we have someone waiting patiently, someone's, but let's go to Bill. Bill, how can we help you, sir? Thank you for calling.
Yes, good afternoon. 2 days ago, my right leg started hurting, like the upper leg and the lower leg, and I can barely step on it.
Have you had any problems before?
I've had the same problem before, and it went away.
When was the last time?
A few weeks ago.
Okay, and last time before that?
Like a few years back.
Okay, so you've got a problem that is becoming more entrenched, and the fact that you had it a couple of weeks ago and then it went now, has that leg felt weak in the past where if you try to go upstairs you don't seem to have the power, even if there's no pain, that you have a loss of strength in it?
Yes, this leg goes numb when I'm crossing the street, and I have to like dig my heel into the ground and it comes back.
Bill, it sounds like, one, you've got a nerve that's not working the way it's supposed to. The nerve that, there's many nerves that go into the leg. The sciatic bundle and the femoral bundle, they come from starting about the upper portion of the low back, lumbar 1, lumbar 2, all the way down into the pelvis. And they control the different muscle functions. And how you differentiate them in examination and history is if you try to go upstairs and it's difficult, if you're walking upstairs, then it's the thigh muscle that's not working. If you go downstairs and it's a problem, then it's the back of the leg. Depending on where the numbness is and where the pain is tells us specifically where it is. But
it's on the outside.
So the outside of the leg is going to be probably lumbar 3. Lumbar 2 and 3, when it goes down to the outside and wraps its way around the front. It could be a little lower. It could be lumbar 4. But that seems to be the area. But it tells me that the nerve is being compressed, it's being irritated, and it has to be treated. If it's treated properly, you can get the function back. But the fact that you have a history that now is becoming more progressive tells me that we've got a chronic problem that now is starting to bite you.
Yeah, and I think also what you're dealing with is there's probably a little bit of scar tissue that's starting to form. And what happened to you a couple of years ago? What started this event?
Okay, I don't remember, but I've been on anxiety medication for years, and one of the side effects, they say, is weakness in the leg. And my right leg has always been weak.
Weakness it would be when you're taking that type of medication, which is one of the side effects, by the way, it's a generalized weakness. It's not a specific one side over the other. And when you get one-sided problem, it's almost always a neurological problem or a blood supply vascular problem. But the way you're describing the problem doesn't indicate that it's a blood supply problem. It indicates that it's a neurological pathway problem. But it can be enhanced and made worse by your medication, but this one now is very much structural.
And I think what's going to happen is it'll continue to get worse. So you've got to start looking at it. This is a physical structural problem. It needs a physical solution to it. You got to open up the aspects of the nervous system to be able to communicate. You got to break up that scar tissue that's probably forming in there. And it sounds like it's. Go ahead.
How do you break up the scar tissue?
Bill, you have to have very specific manual. First, you have to be diagnosed properly, and we have to look at X-rays and so forth. But the manual manipulation, low energy light laser, sometimes acupuncture, it can go a long way into healing the process. And by the way, anxiety problems also can be dealt with on many levels, biochemically, naturally biochemically, and also with acupuncture. It's one of those things that, unfortunately, you're caught in a catch-22, medication making things worse and, exacerbating the problem.
I think also you might have an inflammatory aspect here, too. Do you make sure any other inflammatory things are possibly happening? So you got to address that also.
Bill, thank you for calling. I wish we could get into it deeper, but give us a call at 703-698-7117, and we'd love to help you out and try to figure out what's going on with you. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625, 888-630-WMAL. Love to talk to you on any subject you have in mind. We've got one. We're talking about low-energy light laser, the area of quantum medicine that is just kind of, breaking through in this country, but actually has been around for a while, quite a while. We use it in our practice, and it's one of those things that we wouldn't be without. But low-energy light laser has a very, very specific application, actually, to everything and anything. The problems that we see with joint spaces not being repaired properly, and fatigue levels, and degenerative disease, inflammatory pathways, and so forth, it's phenomenal. We talked a little bit in the last half about it working with Alzheimer's patients and degenerative neurological problems. We see it in our office with people who are ADD. We use it as part of the presentation. We use it with allergy reactions, and it goes on. My guest in studio, Dr. Scott Lamp, who will be your host this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. We'd love to show you this. Scott's going to do show and tell. He's going to actually take a couple of you and show how the application works. It's phenomenal. It's something that, when you really see the application firsthand, you say, oh, my God, how does this happen? But when you think about healing, you go outside, I feel great outside in sunlight. And when the sun's not out there, you don't feel so hot. It's the same type of thing. Cellular tissues at the genetic level respond by light wave stimulation. Dr. Scott.
Yeah, and I think a couple of things we've talked about is that we haven't, like you talk about the Alzheimer's and some of the things that we just mentioned in the earlier half hour. One is circulation. With increased ATP, increased energy, you're going to fuel more circulation to areas. One of the biggest problems with the brain, with brain damaging, is can you get nutrients and circulation to that area? So circulation is one of the things to take a look at. What's interesting in the process, and I don't want to go through the chemical tree of this, but sometimes when you stimulate it with the laser, you actually create in one of the stages hydrogen peroxide. And some of the hydrogen peroxide actually works against bacteria.
That's right. It helps get rid of the disease processes within the body.
Right.
One of the things that I've seen that kind of was interesting, and we don't get into it except with a few of our patients who ask, is that this is phenomenal in the treatment of acne.
Right.
We have several patients that said, can this thing help me? I see that there's a button on it that says acne. I said, yeah, it works, and it's not something that I have a tremendous amount of great interest in treating, but it works, and it works well, and it works without all the other nonsense, and it goes to the place of what you're talking about is stimulating peroxide, and that's why I brought it up. The peroxidase in the skin tissue, subsequently killing the bacteria that on a superficial level is causing some of this very, very pitting acne.
Right. And I think also on top of that, when you're doing repair, since you're doing it a lot faster, scar tissue formation is made quite a bit smaller. So a lot of times with acne, with the acne marks and the scars that happen from that, it actually reduces it considerably. And I think one of the things to take a look at, especially with scar tissue in itself, we're talking about a lot of times where some of these lasers move and hit when they hit the body and how it spreads out. It's almost what they call like an avalanche effect. You stimulate one cell, like kind of you go at the top of a mountain, you stimulate a little bit of the snow, and the rest of the snow starts falling. It will actually work through this connective tissue, which is kind of like monofilaments, like fiber optics. It just shoots out through the rest of the body. I've got an article right in front of me who's talking about somebody who actually had double crushed sciatic nerves on both sides. They stimulate the right side, but they also see the benefits from the laser from the right and on the left.
Well, we know that too just from exercise. If you want to get a limb that to move that's paralyzed on one side, stimulate the opposite side, and you start seeing that crossover take place. But that starts at the brainstem.
Right. And the only thing I want to add with this, too, when you're doing laser work, too, you also make sure your chemistry is there, too, because there's certain elements that help you run this even faster and better. So I like to go back to where you're talking about, or the overall health of the body is structure, chemistry, emotion. All those play a part with this.
Every bit of it. This Wednesday evening, Dr. Scott Lamp is going to be your host. We invite you, we encourage you. This is going to be a great opportunity if you see something very, very special in our practice. Give us a call at 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. And by the way, take a trip through our website at rosellecare.com and check it out. See what we have there for you, because I think you're going to find some phenomenal information. Let's go to the phones for a quick minute. Dave, how can we help you? Thank you for calling. Dave? Hello, Dave. I see you on the screen, Dave, but you're not there. Oh, we got another application. Dave? Dave?
Hi, Doctor. How are you?
We found you.
Hello.
There you are. I knew technology wouldn't fail us completely.
Yes, I have I woke up one morning and I had a muscle spasm in my shoulder area and shot pain up into my neck area. It was very, very bad. I went to see a doctor. He gave me a cortisone shot in my neck.
You're kidding me.
In my shoulder, I meant to say. And they put me on muscle relaxers.
Oh, for God's sakes.
And painkillers. It's gotten better, but it's not dramatically better.
Yeah, when you stick cortisone into anything, it's going to kill what's underneath it. You know, when even in the professional leagues, when they hit a guy with cortisone, which I still am totally against, it destroys the joint space. It starts breaking the neurological system down. It demyelinates the tissue. They can't use it that often.
Right.
And you know, when you're dealing with medications and so forth, it doesn't solve the why is that. So here's the deal. Anytime you have spasm, it's called a symptom and an evidence of something else that's occurring. The muscle doesn't go into spasm just because.
Right.
It's usually the opposite muscle, the antagonist, that is weak. 80% of the time, muscle spasm is a result of opposing muscle not working the way it's supposed to. So what you have to do is you have to find out what it is, and then there's ways of fixing it. There's usually a nerve that's being pinched, or an acupuncture system that's off, or a reflex that can be stimulated. And if it's in your neck and shoulders, what I would encourage you to do in the initial stages is go into full range of motion, like turn your head to the opposite side of the spasm and stretch it. Try to keep your shoulders straight. Stretch it as far as you possibly can. Take your hand on your chin and pull it to that opposite side, and then come back slowly to center, and then bend your head to the opposite side, meaning your ear going down to your shoulder, and stretch your head that way. Get yourself into a hot bathtub with Epsom salt and baking soda combination, half a cup, and see if you can get it all the way up into your neck and shoulder area. Just kind of slide down in that area. And then also there's something called Trameal, or you can also use arnica oil or gel. Rub it in, and that'll help. But now, I'm giving you palliative situations. To me, it sounds like you either have a pinched nerve or you've done something something has happened over time to weaken opposing muscle.
Right.
Do those things, but then get to somebody that does the type of work that we do that can fix you.
You probably have a lot of some type of postural distortion that's reinforcing this along the way. And a little laser on there wouldn't hurt either.
No, laser actually would break that thing up very, very quickly.
Oh, it would?
Oh yeah, it's amazing. When we have patients, we treat a lot of professional athletes and a lot of us who like to go out and screw ourselves up on the weekends, and we get adjusted or get the spinal system corrected, and then use the laser on top of it, and the effect is unbelievable.
I've seen on somebody with a motor vehicle accident with a whiplash ailment where you have about 3 to 4 minutes with the laser on it and improves or range of motion with that one sitting without doing anything else. About 60-80% improvement.
Yeah, you're going to show some of that application Wednesday night too.
Yeah, I'm going to have fun.
Okay.
Listen,
Thank you very much.
You're more than welcome to join us. Dave, give us a call or send me a note on email, and I'll see if I can refer you to somebody. I know you're in Olney.
Yes, sir.
Or if it's not inconvenient, make an appointment to come and see one of my docs.
Okay, thank you.
Dave, thanks for your call. 888-630-9625. My guest in studio, Dr. Scott Lamp. We're talking about low-energy light laser, which will be the topic that he's going to present this Wednesday, and he's going to show you how. He's going to do demos and why this thing is so important. We're talking about cutting-edge applications in medicine, quantum medicine, if you will. It's amazing stuff. The cells divide constantly. And when they're damaged, and it doesn't have to be a traumatic damage, it can be a biochemical damage, it can be a stress damage, it can be all this electrical garbage that we have floating around us that's damaging cells. The laser stimulates the cells to recorrect its programming.
Yeah.
Would that be fair?
And the frequency, yeah.
And the frequency.
Back to the band.
Back to the band.
Yeah.
And so we get everything to work in an organizational manner. And that's the whole thing. Balance is critical, and this is what we're trying to do. When the body is at a place of rest and quiet, stimulated by light, it heals.
Exactly. And I think one of the things is, it's interesting when you talk about chiropractic aspects, sometimes we actually, when we adjust the body and get some of those pressures off, we actually affect a lot of the sympathetic nervous system. We inhibit it a little bit. And so the other system that we have, we call it parasympathetic, which is your rest and digest, stimulates the growth of the body and rejuvenates. And the laser kind of reinforces that. Many
of our listeners saw the MTV presentation last year when I was treating this young girl for very profound allergic reactions. She was suffering with seizures, and she was suffering with anaphylaxis and so forth. And what we used the laser for was to reprogram her neurological pathways to stimulate her body to heal. And that was, everybody said, oh my God, how did you do that? And that was the whole piece. Obviously, we changed her diet. Obviously, we took these things out, and we had to change the structural, chemical, emotional stuff around it. But the laser basically reprogrammed the way her cells react to the irritations, settled the nervous system down, and got her to a place where she wouldn't go into hyperreaction as she was.
Can you talk about how she got to the main event? I don't know if that's allowed to be able to do that or not.
I can talk about some of it. And actually, many...
That's a neurological thing.
Many of our... By the way, if you want to see the whole program, you can go to... go to RoselleRadio.com or go to drtomroselle.com, and you'll find the linkage there. By the way, it'll take you in all of our sites, and I think it's still there on the right-hand side, and you can find it. And Ray Lynn is an amazing lady. At the time, she was 17 years old, and she'd been suffering for many years. When she came into me, she had been everywhere, and nobody had asked her questions about trauma. And what had happened, when she was about 8 years old, she was on the back of an inner tube and being hauled behind a boat. And her head was being bounced on the inner tube. And that was a traumatic situation. Then we kept digging with other things that were taking place as well. And the correlative was that here's a structural induced trauma to the nervous system that ultimately allowed her body to deplete, now becoming more hypersensitive, and everything that she brought in her body now became inflammatory. Her intestinal system began to dysfunction. Adrenal system obviously wasn't working. And what we did simply was fix the nervous system, pull the irritations out, find what was sensitive in her body, what she was reacting to. There was tons and tons of stuff, including things she was washing with and things she was putting in her hair. And then we reprogrammed the cellular neurology at a genetic level, and this young girl no longer has problems.
Yeah, and that's why I wanted to ask you about that thing, because there was an initial event, but everything else accumulated on top of it.
That's right.
More toxins. And a lot of times when you have a neurological event, and especially with this, you might be altering gene expression to some extent. And sometimes these things you need to get it back into focus. And that's the whole thing we're talking about. Get the body back into focus. And neurologically plays a major part with her. I think another thing, too, is her gut tract. Certainly was something she had to deal with.
When you take things out, you've got to fix the intestinal system, because you end up with something called a permeable gut, which means that the barriers of protection are no longer there. And now you start absorbing things that are minimally digested, and now they become reactive to the body.
Yeah, nobody wants to leak.
No, nobody wants to. Scott. 888-630-9625. That's 888-630-WMAL. Yeah. This Wednesday evening, Dr. Scott Lamp and his site Comedy Act will be at our office, and
my toys.
And his toys, and all of his toys, and he's going to show you actually how this stuff works and the applications in your life. And let me tell you something, it's really amazing stuff. It works extremely well, and you're going to say, really? How did you do that? And he'll get into the details step by step and what it really means to your health conditions and how you can use it as part of an overall wellness program, and not just, by the way, to fix something. I mean, this has huge applications with all the other pieces that we do. And as I said, Ages Health is coming up October the 20th. It's our keynote event of the year. And let me tell you something. If you miss this event, you're being very, very silly and very foolish. Dr. Evan Mladenoff, who is one of the most amazing healers that I've had the opportunity to know, and I have to say he's a friend of mine. Evan was the doc for the Kansas City Chiefs for 12 years, and he's going to be talking about emotional healing, how the mind-body connection really works, and how you can apply that. You really don't want to miss this guy. He is absolutely incredible. He's amazing. Give our office a call at 703-698-7117, or go to our website at rosellecare.com. That's ROSELLECARE, and register. get on there before I have to tell you I'm sorry, we're full, and we do fill up every year. Every year it's all done. We're full, and I have to tell people that they can't attend. We're coming up to a break, and as always, we want to remind you that we're here to answer your questions. When we come back, we're going to answer a couple more calls, and I want you to make sure that you understand that anything that you want, anything that you'd like to hear about, give us a call. We'll do it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL, just as we are every Sunday at 12 noon, bringing you the most up-to-date information on everything we can possibly think that you may have an interest in. And today we're talking about low-energy light laser. Your guest, and will be your host this Wednesday evening, Dr. Scott Lamp. Dr. Scott is a brilliant practitioner of all kinds of gadgets and toys, but particularly low-energy light laser and its application to so many things. Scott, we're going to take one more call, but I want to talk about something that happened in the office, and talking about the laser. There was a guy that came in the office, and he had a recluse spider bite, and it was about the size of a 50-cent piece on the lower portion of his leg, and he'd been on 3 courses of antibiotics, and it wouldn't close. It was going down to the muscle tissue. Right. And what we did is we stuck him in the ionization foot bath, and we set the laser for a very, very specific frequency, and we put it over the hole, basically, in his leg for 2 days in a row. On the 3rd day, the hole was closed. Right. And again, this is an accelerating of tissue. It's going to affect the DNA. So actually the mitochondria affects, everything increases in speed. So the aspect of the mitochondria is actually increased DNA synthesis. So like burns. I mean, you can increase the burns. I had a person with a bruise on their head. 2 days later, the bruise is almost like completely gone. And so it accelerates things to almost twofold. So even like in fractures, you can actually work with and getting the microcirculation, and top of that, it gets the batteries moving faster. You get better production. We'd like to invite you to Dr. Scott's presentation this Wednesday evening, the 25th of the month at 7:30 p.m. at the Roselle Center for Healing. Give us a call at 703-698-7117. Love to have you as our guest. Love to meet you. And also, if you're there, you're going to find out how you might be able to save some money on ageless health and the presentation that we're doing. Let's go to the phone. Shelley, how can we help you?
Yeah, hi. Thank you for taking my call. I've been diagnosed with Morton's neuroma in both feet, and it is particularly painful when I'm running for an extended amount of time. The podiatrist made some orthotics, which have been helpful, but don't seem to really change the situation. He indicated the next step would be a series of injections, dehydrated alcohol and Marcaine. Yeah, no, you don't want to do that. So we only have a few minutes, so let me give you a little bit of a skinny on it, and what I don't finish up here, send me a note at rosellecare.com and I'll talk to you. But Dr. Scott, you want to jump into this one? Well, first off is Morton's neuroma. It's kind of like the archway of your foot is collapsing, so we have to actually make sure that's where the orthotic seems to help a little bit too. But you start to change the aspects, the chemistry of that the nerve there. So I think one things like laser would be beneficial for that. So that would be one way to kind of approach it, and also checking your biomechanics through the rest of the body and the foot and the ankle and the knee and the hip, because those also play a part with it. I think that's something you got to have a multiple approach on it. Make sure the chemistry and the laser would work well structurally, maintain that foot and keeping that arch in, because there's a thing called I'm trying to think of the name of the term in the archway that maintains the balance, the arch. Shelley, let me put it to you this way real quickly. I only have a few more seconds. The arch of the foot is, as Dr. Scott says, maintained with the muscle balance, and once that muscle balance is off, the arch is going to drop, and you're going to start irritating that metatarsal area where the Morton's neuroma is, and the nerve is going to form that neuroma, that little tumor. And so once you restore normal foot balance, it begins to reverse itself. It begins to turn itself around. And unfortunately, Shelley, that's the amount of time we have. Please give me a call, and I'll talk to you even more. But it's very fixable. Coming up this Wednesday evening, Dr. Scott will be your host, and we hope that you'll join us again next Sunday, 12 noon, and every Sunday. Tell your friends about it, Dr. Tom Roselle Live. Follow us on Facebook and other social media. We're here for you always. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live, Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine,
can help you experience relief like never before. Simple, safe chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program. It will show you how your decisions can lead you to a life without impairment. You're in control. Health is a Do-It-Yourself Program.
Health is a Do-It-Yourself Program. Ageless Health 101. Available in paperback and CD. Featuring 3 easy-to-listen-to and follow-along CDs with bonus music selections Finding Peace and Change is Beauty. For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.